pathology? Yes? Study of diseases, okay. Straight away you are going into pathology. What do you know about pathology department? No? Have you not come with a prior knowledge here? Did you know where pathology department was? Anybody who had visited this block? No? No? You had met me. Then? Orientation, did we not bring you here? No? You're all sleepy? No? Then I'm not getting any answer. Not even no or yes. No idea. Then I can ask you about pathology teachers. Did you know about pathology teachers? Yes? No, huh? No? Okay. Any idea how many teachers are there in pathology? No. Doctor? 45 doctors, okay. Anybody who you knew in pathology? Yeah? Deputy Madam Shashikala Madam. You seen them? Okay, maybe within the in addition to Department of Pathology, where you are sitting, this particular room is, for Department of Medical Education. So we and most of my colleagues take care of this department also. So we should have, met you in first year, probably to teach you lots about learning methodology and all that. Maybe we have not done. Anyway, let me introduce myself. I'm Dr. Shashikala. I head the Department of Pathology. So you're all, with us. So I have a team of my colleagues, probably who teach much better than me, and so this is a friendly department, I tell you. So to create a conducive atmosphere for learning is very important, so that you develop interest. So all these subjects what you learn in MBBS are compulsory. There's nothing optional. So whether you like it or not, you have to learn. So don't say I don't like pathology, I don't like microbiology, I don't like forensic medicine. Somehow you need to like all these subjects. Only if you develop liking and love towards the subject, and then towards your teachers first, your learning becomes very easy. So if you don't like the subject, at least start liking the teachers who are there. That brings you here and creates interest. Pretend as though you love the subject. So that auto-suggestion, keep telling that yes, I like pathology, I like microbiology, I like community medicine, keep telling it to yourself. Naturally one day, you start liking, but anyway, I want you to have a very easy path from now on to your final year. So now, whatever you lost your 6 months or 1 year, you know why you had lost. So let that not get repeated. It's very common for anybody to fail in MBBS. Failure in MBBS is not a great thing. Only non-medical people do not understand. If you have doctors as parents, those who have taught in medical college, probably they know what is a failure. So even if you fail, they know what would have caused. But non-medical people as parents and your relatives, your people who are around, they don't understand. They come to know that somebody has failed in MBBS, they feel it's something different. So don't bother, forget about your failure, what you have faced, and now from now on it should be a very easy journey for you. Okay? So I will tell you what is this the story of success and how you have to go about. Will you all follow? Yes? So there are 3 things that you need to learn. It's totally the subject that is very important. Knowledge, Only knowledge? Skill. You need to know skills also. Knowledge and skill. See, you have something written exam, your viva was see, and practicals, clinical exams. Is it just enough if you pass in theory? No. Something skill, especially doctors, medicine is an art, we say. So much you need to learn. Only these two things are enough? You feel skills and knowledge are enough? Conscience is very important, more than anything. Pathology or any subject, I'm sure even if I don't teach, you will learn because you have to write, pass the exam. What is above all this? Anything else that makes you the best doctor, best human being? Yes? Patients, you are with the patients. What else? How you need to be with the patients? See, I studied in BMC, Bangalore Medical College, because Manjula is also from Bangalore Medical College. I just remember my UG days, We had some students of chronic repeaters. One person was my elder brother's classmate. He was still in pathology when I was in second year, and I used to, such a nice person. But though he was in pathology second year, I tell you what should not be done he was doing. He was the best practitioner. He had a clinic, he was earning so much. He had started practice. What helped him to be the best practitioner even without MBBS? We should call him as a quack only. He had only knowledge of whatever, anatomy, physiology, biochemistry, and then second year few subjects because he was repeatedly failing, and medicine also he was attending the postings. What made him that best? And we all used to like him, elderly person who used to sit along with us in the class, totally bald and all that, and he was 50 plus that time. What was very important? Confidence is very good. And patients used to go to him. What is very important for you to? Interaction with the patient. Just speak out whatever you feel. Don't keep it with you. After the viva was seen, you will say, I knew the answer. It was at the tip of my tongue, tip of my fingers, tip of the tongue. But that has to come out for the examiner to understand, right? Yes? What is it? Who do you like? People, what sort of people do you like? What sort of people do you like? Friendly? Friendly? Why can't you give me something else? Only friendly people? Yes? What sort of people do you like? Yeah? Kind-hearted, friendly, then? Compassion, then? You don't like anybody? No? You want everybody to like you, right? Yes. You feel so happy somebody says, I like you, I love you and all that. Yes. What sort of people do you like? Only girls in this class know to speak. Yes? Fast. You're able to hear me? Yes? I did not take you to audiometry, right? To test the hearing ability. What's happening? People do you like? Then you love your parents, right? Yeah, they give you so much of love, affection, care. So nicely they talk to you. Don't you think the doctor also has to be like that to the patients? What matters? What is his domain? What is his domain? Heart and brain? Heart. So it is the attitude. Attitude that is very, very important, So you may be a super specialist, you may be a great surgeon, whatever. This is what matters a lot, how you are. Will you all promise me that you will develop that best attitude? Yes. How does it start? It starts from the classroom now. Okay? So let us put discipline as a part of attitude. Yes? So you should be in the class right on time. Yes? Come well prepared. Don't say, I had a class at 8 o'clock. I say, why your attendance is less? Because I have no habit of getting up at 7:30. I just sleep till 8 o'clock. Don't say that. Don't trouble your parents to give you a call daily to wake you up. You're all adults, right? Should you trouble them? You should be helpful for them. No? Do you think your parents will be very happy if you follow all this? So your attendance. So let us keep it as 90%. 90% attendance, the 10% okay. No, for whatever, even I cannot attend all 365 or working days, whatever, no, 320 or whatever is there. 90% attendance, will you all promise me? Sometimes if there is a problem, at least you will come to that up to the mark 75% attendance. So none of you should be detained for quantum attendance. That is one thing. And when you go to the class, is it only for the sake of attendance you go to the class? No. Then, for having been in the class, listening to the teacher, when you go out, don't you think there should be a change in you? 9:15 we have started, and 9:50 you go out. So should there be a change between how you were when you enter the class and when you go out? It has to be, no? You have to gain something. And even as teachers, we have to gain from you and go. Not that I know something and I just come and talk about it. Okay? Yes? So at least by the time you go out today, I want you to have this thought process which tells you what good I need to do, how I can change myself, how I was, from how I was in first year to how I am. You're all growing. There should be that change. Okay? So no, you don't bunk the classes. Be regular. And before going to the class, at least know what topic is taught or what was taught in the previous class. Just go through that. And I'm very happy you've got a handful of students here. Your batch has 47 students. Not too big, not too small. This is an ideal group. I think we would be taking a lot of other interactive sessions for you. So not just alone pathology, from medical education. So let us just interact. Let us learn a lot of things. How to be efficient or how best we can use learn in the practicals and what to do in the theory class, what is not taking, what is not making, how you can remember, you are improving the memory well. So let us take all that. So we just want to take you as a group of students in whom we can see all these changes. Okay? Yes. So before I go to pathology, just I told you about attitude, right? Many of the topics in pathology we teach or anywhere are for self-learning. You need not depend on the teachers to teach you everything. But yes, practicals, whatever slides we show you, what you need to see and all that, that is a must. You may not get it in your home or at home, whatever. But other topics, so once they start, once we induce some interest, once we inspire you, so it has to go as a self-learning process. But first of all, I want all of you to develop this best attitude. Okay? So from today onwards, you should know about 3 letters, A, S, K. So we have put A at the top. What does A stand for? Attitude. S, skill. K, knowledge. Okay? So all these 3 are very important. So in view of this developing the attitude, so she is Dr. Manjula. Dr. Manjula is our associate professor. she has come out with some thing that could help the students to be better. So she's distributing these books. Did you see it anywhere with your roommates or anybody this book? No? Infinite Thoughts, Infinite Thoughts. Okay? This is a very nice book for you to go through, read about whenever you have time. So your 10 minutes, if you reduce your time, spending time on Facebook, then 10 minutes you can spend on this. And no mobiles. Yesterday, my mobile is seized already. It's not just the mobile that is seized. You may say, I will buy a better mobile because I was waiting, to lose this mobile or somebody to take off his mobile, whatever. Money doesn't matter there. But the other thing, how you create that bad impression. Let it not happen. You are here in the class, and once you enter the class, once you sit like this, that means it is giving consent to the teacher that you have entered the class to listen. All of you have taken injection, right? Did you give something in writing to the doctor that, yeah, I am ready to take an injection? No. But how did the doctor know that you have allowed him or her to give you an injection? All of you have taken hepatitis B. So did we take consent from you? No. Did you say that, yes, I am allowing this doctor to give me hepatitis B vaccine? No. But how? How did the staff nurse, the doctor who gave you this, knew that you were ready? The moment we get ready to take, right? Your exposure, deltoid, or whatever, that says you are giving consent. If it is not verbal, not written, but your body language says you are ready. So similarly, once you enter the class, I am very sure that you enter the class for learning. Okay? You should gain each minute, every moment. Keep on learning something. Don't waste your time. Life is so precious, and you are all youth. This is the vital phase of your life. Okay. So no mobiles. Don't ever try to do that. We have said even 9 to 5 we have banned usage of mobile in the campus also. Don't later come and say, oh, I'm sorry, I will not do that. You have been with us for quite some time. We are not just first year students who just entered this medical college, okay? Manjula would be giving you these books. Manjula, you want to tell them anything before giving? So how and why she is giving this book is important. Then in brief, I just tell you what is pathology. So let us discuss for today with introduction to pathology. From next class onwards, I want you to go through the timetable. There's a slight alteration from the main timetable what is there. We have adjusted your classes a different hour. Just go through that.
Good morning. Welcome to the Department of Pathology. This is that magazine is a small step towards really working towards our students. One area, as ma'am was saying, that we acquire a lot of knowledge, right? We keep reading. At the end of the day, whatever I've gained, if I don't apply it on a day-to-day practice, what is the use of that knowledge? Correct. Now, I read so much, but it goes into a dustbin of not being used. It's a waste product at the end of the day. That should not happen with any of my students. That's what my thought process was. So how do I help my students to overcome that area? Main difference between a person who performs really, the person who gets the highest score has same 24 hours as each one of us, right? He doesn't have more than 24 hours in a day. But the way he uses that time of 24 hours, he would not look each minute as a minute. For him it is precious beyond anything. That is what makes that person so unique. So that is what ma'am was focusing on, attitudinal domain. Would you look at time as what? Is it a clock management or is it beyond that? For each one of us, especially in student life, which is I keep saying it to every student, if you really take care of your 20 to 30 years of your life, that itself will take care of your rest of the life. You need not have to catch up with your life later on. So focus is the main point. So this particular magazine will help you in that direction, to shape your life, nothing else. But how each one of us would dream to own a Mercedes, right? Would we not? A BMW? No. But why we can't? Out there in the world, somebody owns a Mercedes. What makes the difference? He too or she too has same 24 hours. Maybe the way he used that time made all the difference. So in that direction, can we really think different? As Steve Jobs says, think different. Not that what your past, what your future has no relevance. You can really shape your future in a totally different direction. But you wish to. You have to take that step. Correct. Whatever we say at the end of the day, you have to sit and read, not us. So in that direction, this magazine will certainly help you to think differently.
Okay, thank you, Manjula. I think we can give them Sadik, so that those who are sleeping would get it. So we're waking you in between by breaking the monotony. Let's have a discussion later, sometime, one evening, probably about 15 or 20 minutes let us sit together and then discuss about what was good in this. Yeah. Shall we start with your introduction?